Good evening, doctors. Today we are going to do pharmacology live MCQ challenge. This pharmacology is a very important subject. It contains at least 25 MCQs. We, if you practice them well, these 25 MCQs may prove a boon so that you score well in your exam. So, NEET PG exam or INACT exam. Let us begin with the first question. Sand ice means dry ice, are due to which anti-glaucoma drug? Now, the side effects of tropical topical prostaglandin analogs is pigmentation of iris, that is heterochromia iridis, and eyebrows, trichomegaly, dry eyes, sandy eyes, periorbital fat depletion. So the correct answer here is latanoprost. This latanoprost can cause sandy eyes. Let's move on to the next question. Fastest acting mydriatic is A. Atropine, B. Homatropine, C. Scopolamine, D. Tropicamide. What do you think is the correct answer here? The correct answer here is tropicamide. Tropicamide is the correct answer. Why tropicamide? Why it is tropicamide? Why tropicamide? Please comment in the chat box why it is tropicamide. Which is the fastest acting mydriatic? Tropicamide. Uroselective anticholinergic drug is uroselective anticholinergic drug is A. Darifenacin, B. Solifenacin, C. Tolterodine, D. Trospium chloride. So what do you think is the correct answer here? Uroselective anticholinergic drug. Darifenacin, Solifenacin, Tolterodine, Trospium chloride. Darifenacin and solifenacin are both selective M3 antagonists. Darifenacin and solifenacin are both selective M3 antagonists. Hence, they are known as uroselective. Darifenacin is more uroselective, more M3 selective. It is the better answer. So, it is darifenacin. Which of the following drug is not used in Tourette syndrome? A. Clonidine, B. Carbamazepine, C. Haloperidol, D. Verapamil. A. Clonidine. Now, clonidine and guanfacine are the current drug of choice for treatment of tics associated with Tourette syndrome. Guanfacine is more preferred due to once daily dosing and lesser sedation. Atypical antipsychotics like risperidone can be tried in patients not responding to clonidine and guanfacine. Finally, if the above drugs are not effective or it is a case of severe tics, then the drug of choice becomes typical antipsychotics like haloperidol, pimozide, and flufenazine. Other drugs that can be used are clonazepam, verapamil, nifedipine, tetrabenazine. So the correct option here is carbamazepam. So clonidine, haloperidol, verapamil are all used in Tourette syndrome. It is carbamazepam that is, in fact, carbamazepam worsens the tic associated with the Tourette syndrome. So let us understand clearly this MCQ. Clonidine and guanfacine are the current drug of choice for treatment of the associated with tics associated with Tourette syndrome. Guanfacine is more preferred due to once daily dosing and lesser sedation. Atypical antipsychotics like risperidone can be tried. Now, the drug preferred in patient with ischemic heart disease with ventricular tachycardia is A. Lignocaine, B. Diltiazem, C. Propanolol, and D. adenosine. So what do you give for this ischemic heart disease with ventricular tachycardia? Now, lidocaine or lignocaine is the drug of choice for the treatment of ventricular tachycardia caused by myocardial infarction. So the correct answer here is lignocaine. Let us move on to the next question. Mechanism of action of azithimib. Azithimib. Mechanism of action of azithimib is A. Inhibit cholesterol absorption. B. Inhibit release of triglyceride in LDL. C. Inhibit HMG-CoA reductase. D. Inhibit HMG-CoA synthase. Inhibit cholesterol absorption. Inhibit release of triglyceride in LDL. Inhibit HMG-CoA reductase. Inhibit HMG-CoA synthase. The correct answer is this azithimib. It inhibits the cholesterol absorption. Which is the characteristic adverse effect of chronic amiodarone therapy? Chronic amiodarone therapy. A. Corneal deposition. B. Cataract. C. Glaucoma. D. Retinal pigmentation. As we all know, it is corneal deposition. What is the mechanism of action of sacubitril? Sacubitril. A. ACE inhibitor. B. Neutral endopeptidase inhibitor. C. Endothelin antagonist. D. Angiotensin receptor blocker. A. ACE inhibitor. B. Neutral endopeptidase inhibitor. C. Endothelin antagonist. D. Angiotensin receptor blocker. Now, this sacubitril is a neutral endopeptidase neprilysin inhibitor that increases the endogenous BNP and hence causes vasodilation along with natriuresis and diuresis. This is approved by FDA in 2015 along with valsartan for use in chronic congestive heart failure to decrease mortality. So the correct term is neutral endopeptidase inhibitor. Lithium induced diabetes insipidus responds to A. Diclofenac, B. Vasopressin, C. Amiloride, D. Indapamide. Lithium induced diabetes insipidus. A. Diclofenac, B. Vasopressin, C. Amiloride, D. Indapamide. It is amiloride. Amiloride is a drug of choice for treatment of lithium induced diabetes insipidus. Furosemide should not be administered with NSAIDs because the latter A. Prevent platelet aggregation, B. Inhibit prostacyclin synthesis, C. Decrease sodium reabsorption, D. Increase the secretion of furosemide in urine. This inhibits the prostacyclin synthesis. Uh, Furosemide inhibits prostaglandin synthesis, which is responsible for vasodilation and partly for solute loss. Hence, NSAIDs by inhibiting prostaglandin synthesis blunt both these effects. So it is inhibit prostacyclin synthesis. The loop diuretic acts at A. PCT, B. DCT, C. Ascending loop, D. Descending loop. A. PCT, B. DCT, C. Ascending loop, D. Descending loop. So correct answer here is ascending loop. Thiazides are effective in both central and nephrogenic diabetes insipidus. Being diuretic, still they are effective in diabetes insipidus because by increasing water loss, thiazide cause compensatory reabsorption of solute and water in the proximal converter tubule. Desmopressin is not effective in nephrogenic diabetes insipidus. As for it to be effective, the V2 receptor must be free and functional. Terlipressin is a vasopressin analog which is more selective for V1 receptor and hence cause vasoconstriction. Thus, it is used for treatment of acute variceal bleeding and not diabetes insipidus. Amiloride prevents absorption of lithium in collecting duct. So the correct answer here is ascending loop. Which of the following is false regarding diabetes insipidus? Thiazide useful in pituitary and nephrogenic cause. So correct answer here is desmopressin is not effective in nephrogenic type. Drug for migraine, which is anti-epileptic. Correct answer here is topiramate. Drug for migraine, which is anti-epileptic. Which of the following gender-specific side effect caused by valproate? It is PCOS, polycystic ovarian syndrome. Valproate causes weight gain, and hence PCOS can be seen in young females. Hepatotoxicity is more common in children aged less than 2 years, hence is contraindicated. So it is PCOS, gender-specific side effect. Drug of choice for mass chemoprophylaxis of meningococcal meningitis. A. Rifampicin. B. Ciprofloxacin. C. Chloramphenicol. D. Doxycycline. Drug preferred in mass chemoprophylaxis of meningococcal meningitis are ciprofloxacin, minocycline, spiramycin, ceftriaxone. So the correct answer here is ciprofloxacin. A patient develops an infection of methicillin-resistant Staphylococcus aureus. All of the following can be used to treat this infection. A. Cotrimoxazole, B. Cefaclor, C. Ciprofloxacin, D. Vancomycin. The correct answer here is Cefaclor. Now let us move to the next question. Ifosfamide belongs to which group of anti-cancer drugs? A. Alkylating agents, B. Antimetabolites, C. Mitotic inhibitors, D. Topoisomerase inhibitors. It is alkylating agents. Methotrexate resistance is due to A. Depletion of folate, B. Overproduction of DHFRS, C. Overproduction of thymidylate kinase, decreased DHFRS. It is overproduction of DFRS. Please click the link in the description box to join the Ultimate NEET PG Masterclass. Mechanism of action of methotrexate is in rheumatoid arthritis is it is decreased purine synthesis. Which is a CCK receptor antagonist? A. Dexloxyglumide, B. Natazepide, C. Ondansetron, D. Pyrazine. Dexloxyglumide is a CCK agonist. CCK antagonist. So the correct answer is dexloxyglumide. Most potent H2 blocker. A. Cimetidine, B. Ranitidine, C. Famotidine, D. Loratadine. Well, the correct answer is famotidine. Longest acting proton pump inhibitor is A. Rabeprazole, B. Pantoprazole, C. Lansoprazole, D. Esomeprazole. It is rabeprazole. The most effective antiemetic for controlling cisplatin-induced vomiting is A. Prochlorperazine, B. Ondansetron, C. Metclopramide, D. Apiprenate. It is ondansetron. So let us move on, revise it. Wishing you all the best.